And today I'm talking about addiction and Addiction 101 and why it's a disease and why we treat it the way we do. So there's a couple of reasons why we talk about this. And one of them is because we call addiction a disease. We label it as a disease, but nobody ever bothers to explain why it's a disease. And so when we put it in the disease spectrum or the disease club with things like diabetes and cancer and broken legs and things, it doesn't seem to garner the same response from the public. In general. And by that I mean, people have this sort of innate sympathy for people who have cancer or even diabetes, like poor them, they have this illness. But with addiction, there may be some sense of poor them, but it's also accompanied with this, well, that's kind of what they get attitude. And so to me, if you really understand the disease, the chemistry of the biology of the disease, I think it's a lot harder to have that attitude. And so, in general, I think understanding and education are what help us sort of move forward. And that's the goal, is to kind of reduce the stigma, understand the disease. The other piece of this is the opioid addiction, which we've been talking about for a number of years, right? Lately. And certainly I'm grateful for this opioid epidemic because it's moved people into this sort of place of seeing addiction the way that those of us that treat it have been seeing it for a long time, and it brought it into the spotlight a little bit. However, from my standpoint, from an addiction standpoint, there really is no such thing as an opioid epidemic. There's addiction, and it's a disease, and it's a pandemic, and it's ongoing. And the main symptom changes what people are using. And I always compare it to that whack-a-mole game at like the arcade where you like bop one down, another one pops up. Like that's really what's happening, is the game is addiction and you're bopping down one drug and another one pops up, and then that becomes a problem. And what we're not doing is focusing on how to unplug that game, how to just shut the game down altogether, which I think is the way that we need to go if we want to treat addiction. And so we're really looking at the disease, not a specific drug. I tell people addiction is like if you have a cold, right? You have a head cold for like years and years and years, but like one year it's just a runny nose all the time, and then the next year it's a headache, and the next year it's muscle aches or something. Like the symptom changes, but the illness is really the same. So the same is true for addiction. This isn't the first time that we've seen sort of this epidemic trend or this mole popping up. It's actually been, for all of time probably. But specifically opiates, we've seen multiple times throughout history. In the 1800s, morphine was prescribed to everybody for everything, right? Because opiates are a really good drug. They fix pain and anxiety, and they help you sleep. And some people, they give you energy, and some people, they give you motivation, and they make life and your in-laws and your neighbors more tolerable, and they're really a remarkable substance. However, we tolerate very quickly, we become physically dependent, and then they cause problems, right? So in the 1800s, they were prescribing morphine to mostly women who had opinions, which they diagnosed as hysteria and or some other psychosis. And so they would prescribe this morphine, and of course they felt good for a while, and then there were problems. So they stopped. And then in the early 1900s, Bayer Pharmaceutical Company invented heroin. It was pharmaceutical grade heroin, and they put that on the market, and it was same thing. They were prescribing it to everyone for everything, and it was like a miracle drug until it started causing problems, and then they took it off the market. And then in the 50s, 60s, 70s, we saw a rise in illicit heroin use, street heroin, but it primarily affected minority populations, so we didn't pay any attention to it like we should have, but it was pretty significant at that time. And then, of course, the recent opioid problem we've seen. But it's not just opiates, and that's my point, right? The whack-a-mole game. So in the 80s, we saw cocaine epidemic, where I think a lot of women were having miscarriages and pregnancy problems and heart attacks and strokes because of this excessive cocaine use. And then in the early 2000s, methamphetamine was kind of a big deal, and anybody that was around during that time remembers that people were blowing themselves up in their sheds making meth. And so we solved the problem by making it illegal to buy cold medicine, right, without your ID. So now you need a driver's license or a state ID in order to get cold medicine at the pharmacy. That's how we fixed the problem. And so then we saw this rise in designer drugs, right? After that, it was bath salts because they're readily available. You could buy them at the truck stop or the head shop or wherever, and you get this like tripping sensation. And then you remember from the news, I hope if you were around during that time, there was zombie apocalypse, right? People were taking bath salts and they were like biting people and like stabbing themselves and doing all these crazy things. So we made some laws and legislated some acts to make it illegal to sell that specific type of drug at the truck stop, and made up some urine tests to be able to look for. I mean, so we just keep focusing on the drug and then a new problem pops up, right? So then the opiates came around. And for years I've been giving this lecture and talking about the opioid epidemic and saying, if you mark my words and we keep focusing on opiates and we keep having opiate task forces and we keep putting money towards opiates only, we're gonna see a rise in methamphetamine. And sure enough, many of the South American cartels are shipping methamphetamine up here very, very cheap. And we're seeing a huge number of people who were stable from their opioid use disorder on medications using methamphetamine in large amounts. And of course, people don't overdose on methamphetamine, but they have strokes and heart attacks. And so in and of itself, it causes a lot of death. It just doesn't calculate the same way as opiates.